a behavioral theory screencast that covers the theory of reasoned action and the theory of planned behavior, also known as TRA and TPB. Our group consists of Samantha Garcia, Sarah Heisman, and Hannah Patterson. My name is Hannah, and I'll be presenting this screencast. The theory of reasoned action and the theory of planned behavior were developed to examine the motivational factors that go into the decisions that we make. These decisions and actions are most closely connected to what is known as our behavioral intent. What exactly creates a behavioral intent? In other words, what are the factors that lead to our decision to behave a certain way? These factors are the constructs of the TRA and TPB, and they are our attitudes, our subjective norms, and our perceived control over the situation. This is an overview of the TRA and TPB. So working backwards from our behavior, you can see close connections to our intentions, which are then directly influenced by our attitudes, subjective norms, and our perceived control. Each of these factors are made up of two more factors, which we will get into detail in the following slides. The TRA was the first of the two theories to be developed. It was initially used to examine the relationship between our attitudes, our intentions, and our behaviors. One milestone of the theory's history is when Fishbein and Azgen in 1975 decided that our attitudes toward the behavior itself were the most direct determinant of performing a behavior rather than our attitude toward an object. For example, knowing the attitude towards getting a mammogram is a stronger predictor of the individual's behavior than knowing the individual's attitude towards cancer itself. This is why, when trying to convince a group of women to get a mammogram, simply by telling them that cancer can be life-threatening is not enough to cause them to get a mammogram. Their attitude needs to change towards the test itself. Azgen termed this connection between attitude toward the behavior and the behavior of principle of compatibility. The TRA was further developed to include subjective norms along with attitude, and later, in 1991, the theory of planned behavior was developed, which added the factor of perceived behavioral control. In 2002, the Institute of Medicine suggested that the TRA and TPB were combined with other health behavior models to create an integrated behavioral model for a more comprehensive picture of human behavior. The first construct, attitude, we've already briefly discussed. However, when looking at the model, we see there are two components: behavioral beliefs and the evaluations of behavioral outcomes. Behavioral beliefs are defined in the text as an individual's beliefs about outcome or attributes of performing the behavior. In other words, what do they think will come out of performing the behavior? Or what do they believe is true about the behavior? Notice that these beliefs don't necessarily have to be true. The individual's beliefs are their beliefs, and they make their own decisions based off of them. The second component is the evaluation of this belief. So to make it more clear, we use the helmet example from last week's module. The belief is that it is uncool to wear a helmet. The evaluation of the belief is that the individual thinks looking uncool is bad. Therefore, the result is a negative attitude and will not motivate the individual to wear a helmet. This can be flipped around. Maybe some other kid does not believe that helmets make them look uncool. They believe that helmets make them safe. This belief they evaluate to be good. Therefore, they have a positive attitude and are more motivated to wear a helmet. The second factor in the TRA and TPB model is the subjective norm construct, which is comprised of normative beliefs and motivation to comply. Normative beliefs are defined as the belief that referred individuals approves or disapproves of performing the behavior. The motivation to comply with these people then weigh in on this belief. Using the same example as before, the belief is that the individuals older brother does not feel they need to wear the helmet. The individual's motivation to comply with his brother is high because they hold their brother's opinion in high regard. Therefore, the result is a negative subjective norm because they are more likely to not wear the helmet. This can also be turned around. Say the older brother feels that they should wear helmets, and the individual still holds their opinion in high regard. This results in a positive subjective norm because they are more likely to perform the behavior. If the individual does not care what the person thinks, then there is a neutral effect on the motivation to perform the behavior or wear a helmet. The final construct added as part of the theory of planned behavior is perceived behavioral control, which is comprised of control beliefs and perceived power. Control beliefs are defined as the likelihood of the presence or absence of facilitators and barriers to behavioral performance. In other words, what is the possibility of outside factors that facilitate or prevent the behavior from happening? The perceived power component that adds in whether this outside factor will make it easier or more difficult to perform the behavior. So in our helmet example, we have the belief that there is a high likelihood that local state parks will have helmet laws. The perceived power indicates that these laws will make it more difficult to not wear a helmet when going to these parks. The result is that, given the individual wants to go to the park, they are more motivated to wear a helmet because of this factor outside of their control. You can flip the belief around to say that there is a low likelihood that there are helmet laws at the state park, which would then make it easier to not wear a helmet. Therefore, the individual is less motivated to wear a helmet. Now that we discussed the individual constructs, we can go back to the model and see how these constructs weigh into our overall behavioral intent. When it comes to wearing a helmet, if we have a negative attitude, a negative subjective norm, and negative perceived control, then the individual is not very likely to wear a helmet. This can change, however, with different beliefs, reference with different opinions, and changes in laws outside the individual's control. The impact of each construct may also change with each individual or population. For example, a child may have a negative attitude towards wearing a helmet, and no reason beyond their perceived control to wear a helmet. However, because their parent or older sibling or friends approve of wearing a helmet, it can be the factor that results in a positive behavioral intent and thus wearing a helmet. Now that we understand the different construct of these theories, we will look into how they are measured for research purposes. The likelihood of an individual to perform a certain behavior is determined using indirect measure. This is done by first evaluating the individual's thoughts on the chance of a certain outcome occurring if the behavior completed, typically on a bipolar unlikely to likely scale. Then the individual's feelings about the outcome are measured on a bad to good scale. These values are multiplied together, and the resulting value determines the likelihood of the individual performing the behavior. So, for example, say we wanted to determine an individual's behavioral belief of quitting drinking in relation to weight loss. First, we would ask the participant their thoughts on the likelihood that quitting drinking will result in losing weight. For example, we use a 5-point bipolar scale. Then we ask the participants how they feel about the behavior outcome. This individual feels that quitting drinking is highly unlikely to result in weight loss. So the first question scores as -2. However, they feel that the outcome of losing weight is very good, which results in a score of +2. We then multiply these two scores together to get a final score of -4. This means that this individual strongly believes that quitting drinking will not result in weight loss, which they report as being a very good outcome, and are therefore very unlikely to quit drinking to lose weight. A prospective study design is recommended when testing these theories. This design allows for researchers to distinguish between different constructs by measuring attitudes, subjective norms, perceived control, and intention at one point in time, and behavior over a period of time. This allows for separation of behaviors that are affected differently by the different constructs. For example, exercise intention is influenced by attitudes and perceived control, while colonoscopy intention is almost exclusively under normative control. As with any study, the results can differ even within specific constructs depending on the surveyed population, whether it be race or gender. So, what is the significance of studies utilizing or looking at these theories? Understanding the different constructs of key behavioral, normative, and control beliefs that affect a behavior are crucial in better understanding motivating factors and barriers a population may face when attempting to change a behavior. Research using these theories will ultimately allow for more successful interventions, resulting in higher rates of desired changes in intentions and behaviors. Watanabe et al. Is a study that utilized the TPB to access intention of participants to consume a low glycemic index diet. They used the construct of TPB to design a questionnaire. They used instrumental attitudes, subjective norms, and perceived behavioral control. The questionnaire was then given to 396 type 1 and type 2 diabetics between the ages of 30 and 75. Results indicated that 90% of those surveyed felt they would have lower or better managed blood glucose levels if they followed the low glycemic index diet. Older age, higher income, being female, having type 2 diabetes, utilizing only diet as treatment, and understanding what the glycemic index is, were also all positively associated with a low glycemic index diet. From this study, researchers concluded that the questionnaire was a valid tool in determining an individual's intention to follow a low glycemic index, which can be useful in determining the effectiveness of interventions in future studies. That concludes our behavioral theory presentation. Samantha, Sarah, and I hope you found our presentation of these theories to be very informative and useful. Thank you for listening and have a wonderful day.